Yeah, of course.
So I'm actually interested in defining a health app because I find in the literature it's quite. There are no strict definitions as I read it. Even though if you're looking into electronic e-health or m-health, things are really there are so many different definitions.
I
But
know,
what's your
digital
definition?
therapeutic.
Yeah, exactly.
Yeah.
Of a health app, if we focus on that.
So when and Orca talk all the time about health apps, and what we really mean when we're talking about a health app is digital health technology. Whenever I use the word health app, the first time I say that, I qualify what I mean. So when I talk about health apps, I'm talking about, of course, apps that you find on Google Play and Apple App Store in health and medical fields. But I'm also talking about any technology which could support somebody from a health or care perspective. Now, I mean, when I talk about health apps, I'm not just talking about well-being products. I'm talking about the full depth and breadth.
Yeah.
So right up to digital therapeutics is what some people talk about, some medical devices, as well as right down to, basic digital information. So the whole thing is what I'm talking about when I use that. So my preferred term is digital health technologies because it covers it all.
Yeah.
It covers health apps and health digital therapeutics. And I quite often use the analogy of how drugs are structured. So from that on general sale up to controlled drugs, we're looking at the whole thing
Yeah.
from a digital perspective.
Cool. I've usually when I'm doing a presentation, I ask the audience whether they use a health app, and then they raise their hand, and I do the same in the end of my presentation, and I think it doubles the amount of people raising the hand
Exactly.
when I'm trying to define it. And I read a super interesting article in Nature a couple of years ago where they looked at chronic pain patients and compared their daily pain assessment with the weather.
Yes.
And they found a super interesting association. Many patients have told me that, oh, my knee hurts, so I know it will rain. But now we have some data behind that, and then you can ask, so is your weather app, is that a health app?
Well, and this is the thing, isn't it? Because our health is determined by so many factors.
Yeah, exactly.
So,
Exactly.
by your, whether you're deprived financially, your financial position, your education, all these things, what your house is like, whether your house is damp,
Yeah.
what food you're eating.
Exactly. And that's
So,
actually the last thing I will ask you, because I'm reading the literature and my personal experiences. So who will use these digital health technologies? I would love for us to develop something that will really help all patients, and especially chronic patients in need, which some of them have a tendency to be of lower social economic status. But
yeah.
unfortunately, we see that they are not always the ones using or responding to new digital health technologies. Can you maybe share some thoughts on that?
So I think that the first thing to say is you're never going to build a technology that meets everybody's
No.
needs ever. And so what we need to be clearer about is saying, who is this technology for, and what are their needs as a demographic group? So if we take something, I'll go back to the anxiety analogy. Most people have experienced anxiety in their life, but not everybody would want the same technology. I'll take another example, diabetes. I live with type 1 diabetes. Now, when I was first diagnosed, I was late onset with type 1 when I was 30. When I was first diagnosed, what I needed then as a technology was different to what I needed when I then got pregnant, and was different to what I want now, nearly 15 years later. And so it's about being really clear when you build the technology, who it is you're trying to help, what is their profile, and where are they in their journey with that condition, because that will then help you to make the technology meet their needs. And again, if you take the drug analogy, we don't just have one insulin or one antibiotic. We are very clear as to which drug will have what impact for what group of people.
Yeah.
And we need to think about the same. So we need an ecosystem of technology.
That's a really good point, that it might change what technology you need during your, even though you are the same person as you were
Yeah,
5
same
years ago.
person,
Yeah.
same condition,
Yeah. Yeah.
but different
That's
technology.
true.